Engage the trained observer.
The trained observer uses verbal commands and a written checklist to confirm each step of donning PPE and can assist with ensuring and verifying the integrity of the ensemble. No exposed skin or hair should be visible at the conclusion of the donning process.
Hydrate. Remove personal clothing in all items.
Hydrate prior to donning PPE. Workers tend to get very warm in PPE and can dehydrate easily. Also use restroom if needed prior to donning PPE. Workers should remove anything that has the potential to poke a hole in or interrupt the integrity of the PPE, including jewelry, pens, badges, belt, cell phone, any items in pockets, etc. Prior to donning PPE, it is important to screen overall health by assessing baseline vitals. This helps to ensure the readiness required for the rigor of working in PPE.
Inspect PPE prior to donning.
Inspect each item of personal protective equipment. Ensure nitrile butyl gloves do not have holes or tears. When inspecting the suit, examine all seam integrity. Prior to use, place a paper clip onto the zipper tab and cover with duct tape, creating a pull tab. The boots, safety goggles, and the N95 respirator should be visually inspected for damage prior to donning.
Perform hand hygiene with decontamination solution.
Alcohol-based rubs should be allowed to dry 15 seconds. Do not speed drying by waving hands.
Don your inner nitrile gloves.
It is sometimes helpful to choose a smaller actual size for the inner glove and a size up for the outer glove to ease donning and doffing of the outer pair of gloves. It is desirable to have a snug fit over the wrist and forearm to minimize the risk of exposure.
Don your level 4 suit, zip the suit, and inspect.
Suits are available in sizes medium, large, extra large, 2XL, 3XL, and 4XL. Typically, it is best to choose a suit one size larger than is normally worn. It is better to wear a suit that is a little big rather than small, as a small suit makes movement and doffing difficult and increases the risk of breach of PPE and exposure. The suit needs to be large enough to allow the worker to bend over and squat and flex arms without stressing the seams.
Don your Tingley boots.
Assistance from the trained observer may be required. Boots should be put on while sitting down.
Don your N95 respirator, assuring adequate seal and placement of straps.
The Spirion Safety Fit Plus N95 respirator has an exhalation valve. The provider must have been fit tested for the mask. When inspecting, be sure there is a good seal, masks should collapse when worker takes a deep breath, and that the straps are separated, with one being located at the lower portion of the head and the second located higher.
Don your level 4 suit hood, secure the storm flap, and inspect.
Be sure all hair is inside the hood and there is a good coverage over the forehead. Long hair should be secured with non-metal hair accessories, as metals such as that used with barrettes may threaten the integrity of the PPE. Metal bobby pins may be used providing the ends are covered. It has been noted that the elastic around the face of the hoods tends to collapse and cover the face on those with smaller heads or narrow faces. Finally, secure the adhesive strip on the storm flap.
Don your safety goggles or face shield and inspect.
The fit of the goggles should help secure the fitted hood of the Level 4 suit. For those wearing glasses, these goggles should fit over most eyewear frames.
Don your outer butyl gloves.
Encourage trained observer assistance. When inspecting, be sure there are no rips, tears, or holes. Be sure the cuffs are pulled up the forearm as far as possible and that the suit gown cuffs are secure under the glove. It may be helpful in donning and doffing to choose one size up for the outer glove.
Disinfect your outer glove.
Alcohol-based rubs should be allowed to dry 15 seconds. Do not speed drying by waving hands.
Verify no skin is visible. Be sure the N95 is functioning.
This is the final inspection before the worker enters the work area. Do an overall inspection to be sure that all PPE is donned appropriately.